Hi everybody, I'm Dr. John Degenhardt. I'm the host of Let's Talk Chiropractic. You know, Jillian, about 30 years ago, I started these TV shows because I really think that people are afraid of chiropractors because some are too rough and they don't even know what chiropractors do. So I'm excited about these shows. She is not a paid actor. She's going to tell you her real life story and then you're going to see what the adjustment is like. So Jillian, tell the audience a little bit about who you are.
My name is Jillian. I am recently married. I have twin daughters who are 4 years old, and I am a school teacher at Mahanoy Area Elementary School. This is my 7th year teaching 2nd grade there.
And I'll be honest, in my 44 years of being here, I love teachers. They will get a salary and some of their money they spend on supplies that the school district doesn't pay. So thank you for being a teacher.
Thank you.
Okay, so let's take a little break. We're going to come back and talk about her story. So I want you to get in my shoes. About maybe 2 months ago, Jillian comes to my office and you look at the case history. School teacher, numbness down the right arm, migraine headaches. So you ask a patient, how bad are the headaches? What did the other doctors do before you saw me? So Jillian, tell the audience the whole story. Like, so before you met us, you were getting what, numbness down the right arm and headaches at the same time?
Yeah, so for about 4 years, I have suffered with migraine headaches. I would say I had about 15 or more a month. I was seeing neurology and I did get approved to get medical Botox for my migraines, in which I was very hopeful to receive. That was in July that I received my first injections. Knowing that I was suffering with these migraines, it was affecting my life, affecting, being a mom, being a school teacher. That's half of the month you're spending your life. I mean, I did have medications, to prevent. And when I did get one, it would go away after I took the medication. However, I knew that wasn't normal. So that's when I got approved. And my first injections were in July of this past year, which I was so hopeful and excited for. They do inject, in the areas where you would think, in your forehead, in your head, and specifically, more so in your neck and trap area. They did say that I would experience, some maybe mild soreness from the injections, but when I woke up the next couple of days from it, I experienced something that I've never thought I would from this, which was just significant burning pain in my neck, back area that would shoot down into my arm, and I knew this was something that was not normal.
So migraines suffer for 4 years, goes for Botox shots, hopeful that it's going to alleviate the problem.
Right.
So when it sort of resulted in numbness down the right arm, did you go back to that doctor?
I did seek out, to who did my injections, who said there's no way that this pain could be from these injections, that we could try, just maybe a muscle relaxer to see if that feels better. Other than that,
Okay.
I felt kind of like I was on my own
And
there.
Who took x-rays of your neck prior to seeing me?
So after I talked to neurology, I did reach out to my primary care provider, who then put me on more muscle relaxers and some pinched nerve medication and said, let's get an x-ray of your back to see too.
Now you were here a week ago. Remember, you brought me this cervical disc.
Mm-hmm.
We looked at it on the computer. But before we talk about what was on that x-ray, they told you what? The x-ray was normal.
Yes, they sent me a message and said, looks like great news. Your neck it's normal. And in the back of my mind, I'm thinking there's no way what I'm experiencing is normal. Yeah. There's no way.
Now you weren't getting anywhere, and I guess you must have vocalized to your father, I think maybe I should go see a chiropractor. What did he say to you?
He said, do not let him hurt you.
Yeah.
And I said, what?
And that's why I do this show, Jillian.
Mm-hmm.
I'm not afraid to pull all the stops. There are chiropractors who, you're a young woman, they would just get your neck and rack it,
right,
thinking they're going to get faster results. And in my opinion, they would make you worse. And your father probably, I don't know your dad, never met him, but he probably has heard those kinds of stories. So when you finally, how did you decide then to come to this office?
the teacher that works right next to me, actually, we share stories of things, and I said, "Do you know any chiropractors?" And she said, "Actually, I do," and recommended you guys, and I called right away and to come in, and I said, "I just want to find somebody that I could finally sit and just share my story with and listen, because through neurology, my primary care provider, I felt like I wasn't being listened to, and I needed someone just to hear my story and just be patient with me."
When I hurt my own back years ago playing sports, I felt like you did. You feel like no one's really listening to me. You're trying to say, help me. I feel worse from the Botox shots, but they're, of course, are going to say, well, no, there's no way the Botox shot. So when you came that first visit, you remember? Were you scared or nervous, thinking, oh my God, what is this first visit going to be like?
For sure. But in the end, I'm like, I know this is my last resort of what I need to do, is to see if we could fix it this way. From the minute I met you, I felt like when we sat down and you said, "I'm here to hear your story and to hear why you are here." And I think that just made everything so much more comfortable, that I didn't have any care, not care, but just I had no worries, that I knew I was like in good hands.
But Jillian, it's critical. When you're here 44 years and I've seen over 1 million patients, it's critical to slow down your busy day and listen, especially that first visit. Your story is a beautiful story where, it must have been frustrating to have these migraines. I think what you were saying earlier, I was able to be a teacher, John, but on my headache medication, I wasn't as alert or as happy and not as much of a teacher.
Right.
It must be hard to cope with 27 kids if they're, rambunctious. So it's a joy for me to say, okay, let's put the puzzle together. What's causing her migraines? I think the Botox shots try to relax you, but as they relaxed your tissues, it made it misalign further, causing this numbness. Nothing against the neurologist. They were trying their best to help you. But as we discussed that, I said, well, let's see if I could gently move the bones off the nerve, first down the arm, and then eventually to reduce the headaches. So on the second 7 minutes, we're going to talk about what the x-ray showed, because remember, we looked at it together.
Right.
Here's the mistake I think they made. On the cervical x-ray, the upper cervical spine was perfect. C5, 6, and 7, good disc spaces, no arthritis, no cancer. So they quickly say, normal. But even you as a layperson said, wait a second, but then what's causing this? As you looked lower, and I didn't think we had enough time to show the x-ray on the show, but on the lower C6, C7, T1, your disc spaces are compressed, pressing on a nerve. So when they gave you the Botox shots, they relaxed it, made it cause even more compression, and that's why you came to me.
Right.
So nothing against Botox, but
No.
I think when you look back at it, it all makes sense now. So my job then is to try to adjust this neck, not in one hard crack, but little by little. So let's talk on the next segment about what the adjustment was like, how did she feel, how was she feeling, and then we will show you what the adjustment is like. So take a little break. I can honestly say to you guys, I love being a chiropractor. I feel like I felt my niche just like you did as a teacher. I pray when you impact these kids' lives, and you're young yet, when they call you, sometimes 10, 20 years later, my teachers get these beautiful letters. Thank you. I have a good job because of what you did 20 years ago. So we all have to find a niche, a purpose in life, and I feel like this is my purpose. So your story is a beautiful story. 4 years of migraines. Botox shots to relax the muscles caused it to compress the nerve, making even the right. Her beautiful father, who I'm sure you love and respect, says, don't get hurt by a chiropractor. And I respected that when you told me that.
Right.
When he watches the show, he's going to say, boy, this guy's not mad at me. Not at all. That's my attitude also. So on the x-ray, we saw compression of the nerve. So then my thought is, be gentle with you. That first visit, I don't think I got you and racked you. You were so tight up there, we used a drop piece table to just gently shift the vertebrae. And then we talked about decompression, a device that you take home and you pump it. So as you slowly stretched your spine, you decompressed it, then it allowed me to gradually, over the last 2 months it took us, to adjust you. So let's go back. How did you feel with the gentle adjusting and with the decompression machine?
Right. I think when you first step into, have a visit with a chiropractor, you're thinking, like you said before, a lot of cracking and, you're a little nervous about it. But I don't even think the first visit when we came here, we even went to that step of what you would think that a chiropractor would do for you. I knew that, you said I wasn't aligned. We got me aligned and I was just very tight. And you said this is going to take us, a couple visits for us to, get where you need to be. And the fact that you knew how to do that and to be gentle with me was more appreciated than anything I could ever ask for, just because it's a scary situation when it's your neck and you're in pain and something is wrong.
So the big picture, somehow the base of your neck got compressed years ago, causing these migraines. So my thought was, John, you can't change overnight what's been going on in her body for 5 or 10 years. So we first tapped it gently, and we're going to show that on the machine. Then as I felt your body started loosening up and responding, I remember I laid you on your back, and we'll show that. Then we get a very gentle little click. Here's the psychology, Jillian. Many chiropractors will say to me, John, by impressing the patient, the more I crack, the more they're going to feel like they got their money's worth. And they don't get it. If they communicate and get the patient to understand that, Jillian, this has been tightening up for 4 or 5 years. I'm going to be gentle. Just trust me and give me some time, which is what you did. And then gradually, will you tell people, how were your results? How are you feeling with both the numbness in the arm and the migraines? How are you doing?
So this has been, just a little bit of a ride, just because I came in here with such extreme pain. From my first visit in, I think like late August I came, until, now seeing you, whether it was 2 times a week, and now we're down to 1 time a week, and once every 2 weeks, shows that this has obviously made a difference for me and that we are improving, and it is so much better. I feel I could lift my children again. I feel I could just do daily tasks again, just be myself. And even though I know we're going to get exactly where we need to be in the next few visits, this coming here has changed.
So let's be open. So I think what you're saying, John, are much better, but do you still have a little tingling yet in the arm?
A little bit, like a little, I can feel definitely like it's there, but a tiny percent. Like it just very.
But we're on the right track.
Yes, like you could just tell from the way I would drive up here every time, and I think to myself, oh man, it hurts today driving here, and I don't feel that way. Like today coming to see you, I don't feel pain, even driving up here compared to what I did in like September.
You're going to be boogieing at a wedding today.
We are.
So yes. I got to make sure you could dance without hurting your neck.
Yes.
But explain to people, I felt there was compression in your neck. So explain to them, what does that decompression device feel like at home?
So we take the device and, pump it up to where I'm feeling that it is, right comfortable for myself. And it is keeping, my chin up. Having that it's hard to look down. We are normal humans. We look at our phones. I'm bending over in my classroom, to, help students and things like that. But that device is something that I wear after school, or before bedtime to really give that stretch of my neck area. And it's clearly working. So I feel I'm doing homework for you kind of, because you're telling me these directions of what I need to do, like on my part, as well. So
I just have so many teachers, and they all look down at the kids' papers and tests. So I know that's going to help. But my ultimate goal, no numbness in their arm, no compression, no migraines. Have the headaches even been a little bit better?
Yeah, I mean, they're there, but they are, they're manageable for sure.
But so again, here's the problem. These other chiropractors, rather than you coming 12 visits and giving me some time to change your life, they think, well, let's impress this. Let's rack and crack so hard, 5 years of damage, and then those are the horror stories. I love my profession. Probably you as a teacher, your heart breaks when you probably hear like a teacher having a relationship with a child. My heart breaks when I hear a chiropractor who cracked the neck too hard, scared the patient, and then they think that we're all the same way. So again, folks, not every chiropractor is the same. Jillian trusted me. She's not there yet totally, but she's on the right track.
For sure.
So we're going to go down the hall now. I want you to see how I adjusted her initially. no cracking. She was too spastic and too much pain. I would have aggravated it if I did it a lot. We looked at the x-rays where there was compression of her lower neck. I pray in about 4 more visits. No numbness in her arm, no migraines. So those of you who are afraid of chiropractors, have an open heart. Even her father said, don't get hurt. Yet she had the courage to give us a try. So I'm glad you did.
Thank you.
Okay, so let's take a break. We're going to go down the hall. Let's see what the adjustment is like. Hey everybody, I think this is the best part of the show. I think for many years people wonder, what is a chiropractic adjustment like? And every chiropractor is different. Some guys prefer to be rough. I can be rough if need be, but don't think that you get faster results by being rougher. If anything, I think it causes more injuries. So quick summary. Jillian for 4 years had migraines. Went to doctors for Botox shots to relax her muscles. They meant well, but by injecting her, I believe it relaxed it and caused even more where her lower neck went right, pinching the nerve down her arm. She goes back to that doctor and he's not going to say, sorry, yeah, I caused it. He's so the patient feels like no one's listening to me. I'm hurting. The Botox shots, which I thought were going to help me, made me worse. So thank God, a fellow teacher says, try my chiropractor. He's not rough. Maybe he can help you. So on the first visit, I palpated her muscles. She was so tight. The first thing I said, I am not going to be rough with her. I am not going to crack her. And then she says, my dad says to me, don't get hurt. So all the more, I don't want her father throwing a pumpkin at my car. So very gently, her bone was off to the right. We're going to first show you the gentle technique of moving it gradually. We gave her a decompression pump to stretch her spine. And then as she improved, we were then able to twist her. So knowing people for 44 years, listening to her body, doing it gently, that's why she's doing much better coming to this office. So we're going to put her down and we'll show you that process. So hands up here. Pretty much her pelvis, I think, was always in a alignment. Jillian, you never had any lower back pain, did you?
No, not abnormal.
Yeah, so her lower back is not an issue. It's just her upper spine. So again, just to give people a view, in my mind's eye, this is what I'm looking at. This is her spine. Her lower neck went right, pinching nerves. On the x-rays, there's compression of the disc. Her upper neck is jamming her occiput, causing her migraines. So when she first came to me, I'll come to this side so I don't block the TV viewers. This is the most expensive table you can buy as a chiropractor because it's more versatile. It gives me options. So we would get on the base of her neck, and just as we tap it, as the table drops, it moves it ever so slightly. The patient might be thinking he's not even doing anything, but you have to make gradual inroads to the body. So we probably did this, from what I remember, maybe the first 2 visits. She had to put ice to reduce inflammation. But then gradually, we said to her, the human head weighs 10 pounds. God gave us 7 vertebrae in the neck to support the weight. She got so tight, I think her neck has been out for probably even 10 years, causing tension, causing migraines, and then this numbness down her right arm. So as the neck starts to improve, it'll support the 10 pounds of her head. This will get looser. And sure enough, which was so tight the first couple weeks, now when I'm going to see if it moves a little bit, we get a little like a click, click, click. Get the spine to be looser. So slowly we want to decompress her discs, and that takes months. There's no fast method. You know, if a teacher says to a student, you know, teacher, how fast can I learn division? It's not going to be overnight. It's a process. So that's what I do as a chiropractor. I talk to my patients as if I'm a teacher so they understand what's going on. So Jillian, take a deep breath and exhale. And you were just here a few days ago. There's a couple little ones. Good. So Jillian, you probably can't hear that on the camera, but Jillian and I can both feel it. Mm-hmm. It was like a little movement where the spine is loosening, opening up the discs, taking pressure. Here's why I think I'm a little bit of a fighter. Neurologists will call me. They'll say, John, we're going to do a CAT scan of her brain for her migraines. I said, go ahead. You're not going to find anything. It's all in her neck. Sure enough, I have hundreds of women who get CAT scans of their brain. The migraines have nothing to do with their head. So then they give them antidepressants. I thank God that you came here, Jillian, because now we're going to show you how we adjust the neck. Well, eventually she will not have any migraines. There's nothing wrong with her brain or her head. It's her neck has been damaged for years, and now I'm trying to reverse that damage. So now we bring up the table, so bring your toesies on the table. These high-low tables, she's young, she can flip on and off, but an 80-year-old patient, Joan, they like these tables because they don't have to crawl on and crawl off. Okay, on your back then. So the first couple visits, we tapped her gently. And she is a good student. She is using the decompression machine at home. Well, like an hour a day, or how often?
Yeah, you said minimal, so I mean it's definitely minimal. And out, when I put my children to bed and I have that on watching TV, so
Good.
it could be longer than that.
So my vision is one day, no numbness at all, no migraines. Then you can do that very less often. So she can feel it. There's a hardness way up top that's causing her migraines. The low, so I think, Jill, when they gave you the shots to relax you, it made it relax and made it cause even more of a pinched nerve. And again, not putting them down. They were, I'm sure, dedicated to helping you. Okay, so we're going to go very gently. We want to shift her vertebrae left. Nothing there. And again, we just did this about 2 days ago. So it might not need it, but I just want to show on camera. We try a little bit, and let it fall. Good, that's all we're doing. So it didn't really crack much today, but I'll be honest with you, it just did 2 days ago. And my point is, I do not want, it's like going to the gym and doing too much too soon. But that's the process. If you're really hurting, don't give up on chiropractic. Find someone who's gentle. No matter how busy I am, we very rarely stop for lunch breaks here. But I can discipline my brain to listen to her story. And we both clicked. I could understand where the problem was and where those guys overlooked it. So it'll be a joy to get rid of her numbness in her arm. It'll be a joy to get rid of her headaches. So I believe our work has changed people's lives. Tell us your friends if they want a gentle chiropractor. I never want to retire. I want to go as long as I can. Thank you so much.